Hey, so I wanted to hop on here, and I don't know who needs to hear this, but there has been a lot of controversy about the new Ozempic Monjaro shots, and I wanted to go through a quick video unedited because, when you have a one-to-one with your physician, you're not going to have time to edit the clips. So here's the breakdown. Gastric bypass surgery. What is it? Gastric bypass surgery is when the surgeon goes into your abdomen, finds your stomach, cuts out half of it basically, shrinking the size of your stomach. Now, over the course of 30, 40, 50 years of your life, you've been eating food, and that stretches out the stomach. It's just like any other muscle in the body. The more you use it, the more it grows. So gastric bypass surgery goes in, cuts that part, cuts the excess muscle out, ends up shrinking your stomach. You eat less food, you eat less calories, you end up losing weight. How about the shots? So if you've probably been following any of the news, a lot of the celebrities and trainers and all that have been taking Ozempic shots or Monjaro shots. Now, what are those? Those are type 2 diabetes drugs. They trick your body into kind of believing the same exact result that you get from gastric bypass. What does that mean? It means that it's a GLP agonist. So agonist meaning that binds to the receptor. It releases increased insulin, decreased glucagon, and increased gastric emptying. What does that mean in layman terms? It means food in your stomach stays in your stomach a lot longer, and therefore your stomach gets full a lot faster. The receptor also releases a set of hormones in your body to make it feel like you're full, so you don't have the drive to eat as much as you were eating before. What does that result in? It results in losing weight over the course of 3, 6, 9 months. So it's kind of like the same thing, but you don't get the complications of surgery. What kind of complications can you get from surgery? There's quite a few actually, but some of the common ones, you can end up with adhesions, which cause obstructions in your bowel that lead to small bowel obstructions. You can get hernias. You can also get infections at the site or leaks, and all those things are potentially catastrophic. Now, the shots themselves also don't come without side effects, but the side effects are a little less severe when they happen. Most of the side effects are kind of have to do with your GI tract, so indigestion, diarrhea, those kind of things. There are even more severe cases of pancreatitis and cancer that can come from the shots. But on the flip side, versus having obesity or morbid obesity where your BMI is greater than 40, it's like kind of a risk-benefit ratio. So in that sense, sometimes it's actually, after a discussion with your doctor, it's actually better to go ahead with the shots because you'll lose weight. When you lose weight, your quality of life will improve. You also have less risk for heart disease, pulmonary disease, GI disease, diabetes, all the things that come from having too much weight on your body, including impacts to your bone health, your ability to walk around, play with your kids, play with your grandkids, all those kind of things. So it's kind of a risk-benefit analysis that you'll have with your doctor when you get to your doctor and ask him about weight loss. But I wanted to hop on here and kind of give you my opinion about the two. So if I had the option and I was overweight and I had to choose between getting the surgery or trying out a trial of these type 2 diabetes meds that are not FDA approved at the moment for weight loss, I'd probably go ahead and take the shots. Why? Because surgery always has complications, right? Now, the majority of people get out scot-free, end up doing really well with the surgery as well, but you're exposed to general anesthesia, you're exposed to pain medication, you're exposed to infection risks. With the shot, you can always trial it, see if you'll lose weight. And if you do lose weight, you can often maintain it because your body now is used to living on less calories. Is it a little bit of a struggle? Of course. But if you go to a weight loss clinic, they'll put you on these shots and they'll also give you a rigorous outline of, what to eat, what not to eat, and how many calories to consume. Typically, what I've seen from my weight loss colleagues is they'll put you on a restrictive diet. So you'll be eating somewhere between 12 and 1,400 calories a day. Now, where do the shots come in? The shots come in a form of decreasing your appetite, hunger suppression, which allows you to eat less and not feel hungry all the time. That ends up benefiting you in the long run because you lose weight because you eat less. The weight loss clinics expedite that process, make it into a 3-month chunk. You end up losing the weight. You can drop 5 pounds a week, 10 pounds a week from the severe calorie restriction, but a lot of the folks in the industry are starting to adopt a longer term approach to weight loss. And that approach is kind of like a maintenance shot. I don't know if I agree with it. I don't know what the data is, but when you weigh all the risks and benefits, if you are morbidly obese, if you are obese, you want to lose weight, you just kind of need that kind of push or that punch to get you to lose weight, then the shots are a great option. They give you the opportunity to kind of start your weight loss journey. And, to be honest, once you get the first 10, 15 pounds off, your body's going to change. You're going to notice it, and you're going to start to get more motivated. You probably will end up losing more weight in the long run than you thought you could. But the shots kind of give you that first little boost. It's kind of like the same principle with trying to quit smoking and using Chantix or using Nicorette gum. They're not the end-all, be-all, but they give you the first little boost you need. And once you have that boost, you can start the journey. And once you're on that journey, your life's going to be a lot better. Your health is going to be a lot better. A lot of the blood pressure medications you're on, you'll probably come off of. And so it'll kind of steamroll, and your quality of life will improve. This is not an ad for those shots, but I did post a TikTok video, and I got a lot of controversy over it. People are saying, oh, you can't take the shots and not eat healthy. Well, that's true. I mean, obviously, if you want to lose the most amount of weight in the fastest amount of time, you want to eat healthy. You want to work out, you want to eat salads, you want to eat protein, you don't want to eat fats. All those things are true. However, a lot of people who get to the point of being obese are used to consuming not healthy foods for a long period of time, 20, 30 years. So to tell them the next day, quit cold turkey, it's tough. But the results are crazy. I see patients all the time that have dropped 20, 30, 50, 100 pounds from these shots just because they're not eating as many calories. And I can't stress enough how important that is. You sign up for a fitness instructor or weight loss instructor on Instagram, they're just going to tell you to count your calories. When you choose what to eat, you base it off of calories. The total amount of calories in minus the total amount of calories out is how much weight you're going to gain or lose every single day. So I just wanted to hop on here, obviously, give you kind of a breakdown as to what my thoughts were. And you're going to want to always check with your primary care doctor, what's right for you. Obviously, each situation is individual. You can have some sort of medical reasons for not getting the shots. You can have a history of cancer in the family, history of pancreatitis, all those kind of things. So you have to talk to your own medical professional. But I wanted to give a quick breakdown, And if you guys enjoy these kind of videos, please let me know, because I can kind of break down medical issues, medical controversies, medical hot topics, and more basic nuanced verbiage that might connect with the average person and might be able to help you understand it. That's all I got for this quick video. Please like, subscribe, all that kind of stuff. Thanks.